So lymphatic massaging is about moving the fluid from everywhere in the body out to the appropriate exit zones. So we're going to make sure that we clear the fluid from the top of your head to make sure that it vacates to the appropriate lymphatic zones. The lymphatic zones start behind your ears. So we're going to start to make sure that from your head, we vacate the liquid behind your ears. And then we're going to come and make sure that it vacates appropriately here at the neck where you would swallow, where you breathe. That's actually your neck's lymphatic zones. Then we also have the lymphatic zones that are under your arms, where your sweat glands are. Then we'll be coming down to your pelvic region, where your main lymphatic zones to vacate all liquid, right? Where you use the bathroom, right? That's your complete lymphatic zones. And we're going to come down the legs and make sure that behind your knees, where our next one vacates, and down to your ankles. We also have in your arms, in your elbow area, a lymphatic, so we'll come down, but it's very small. So the one here, the elbow, the one here in your ankle are the tiniest lymphatics. So we're going to do as best we can to vacate the fluid in the major zones, and in the elbows and the ankles we'll do minor. From the top of the head, you can do this self. I'm going to do it and I'm going to show you with your hands. I'll have you come, but you want to start at the top of the head. You actually have fluid, which you know that moves your neurological system, it moves your brain waves, everything. There's fluid in the brain, but it does trap. Any sugar that you intake in your body traps itself in your neurons in the brain. So how we want to move that fluid is we want to start at the top of the head and bring it down to your ears. And I'm going to show you. I'm going to take your hands and I'm going to show you as you bring your hand, you're going to apply this much. So it's almost just simple pressure, easy down to your ears, and you want to do it from 6 to 10 times. Yes. 3. And the top of your head around your ears, because you have fluid all the way at the top of your head. One thing I like to say, when you're moving fluid in your body, you always want to be cognizant, of your positioning. So laying down is always optimal anytime you're moving the fluid in your body, because you could end up dizzy based off how the fluid is moving. Yes, very good. I'm going to let your hands roll down, okay? And then and so normally, and just because I'm here doing this, we're kind of trying to show self as well as someone else helping you, is I'm going to actually kind of go from the top of your head just to kind of give you a break. But the same thing, just to kind of give you, but I'm going to do, because you really want to do the whole head. So what I call is almost like a band. Like if you had electrodes on your head, and many of you might have had that experience where you've had electrodes attached to your brain to moderate whether it was a stroke event, whether it was a brain event, whether it was, aneurysm, whatever you might have been through. And they have 4 bands they put around your head. So I imagine 4 lines with your 4 fingers, and that's where you want to do. So here being where my first finger lied. And we're going to do that. And so it would be the same thing for you. And you can do this to yourself. But since I have you here and you have the opportunity of having someone to help you, but it's the same thing that you could do to yourself. But it's always nice to have a lymphatic person to help you.
If I'm at home trying to figure out how much pressure to use, or if it hurts the shoulders, what would be a good way to test pressure?
So I say you take your pointer finger. So your pointer finger are what they do pressure. So depressing, where that's it. So you almost just take your pointer finger in your hand and literally as if you were just holding on. That's all the pressure that you need. So I would say it is very minimal. If you had to put like a pressure against it, it's literally 10%. So it's very minor down the skin, because the whole idea is fluid is actually right under the skin in the fascia part of your body, which is right under. the first layer of your skin. So it doesn't take much to move the fluid. And again, you want to do 6 to 10 times anytime you're moving fluid. And again, what we're doing is we're starting at the top of the head and we're doing the 4 bands as if you had 4 fingers. You could, like you see me taking all 4 fingers down to the ear. So, I mean, it could be. And is this hurting your head by any means?
It's a little, the pressure on my neck is a little, the pushing down on my neck is a little high. Yeah, that's better.
Because it doesn't take much to fluid. This is not about being painful.
Mm-hmm.
This is literally about releasing. So it is important, if you feel pain, then pull off the pressure. You don't need to like lock on to the body. You don't need to like where you're leaving an impression.
Mm-hmm.
It needs to be only about moving the fluid.
Stay in comfort.
That's right. Where you don't want to hurt. It's not about hurting yourself. Once you get the top of the head, we go from the forehead, because here's our sinus, right? The sinus cavity, because we runs from the top of the head right here to like the cheekbone is your sinus cavity. And so we want to start from the top of the forehead to go to the top of the ear to move that fluid. And so we're going to do that again 6 to 10 times. The second point is right above the eyebrows, kind of where you feel almost the cavity begin above your eyeball. Here, let me see your hand so that you can see and feel what I'm talking about. And so you're going to simply apply the pressure to your ear. And it's literally starting at the bridge of your nose and coming down. Nice, easy. And that's 3. Do it 3 more times. 4. 6, and relax your arms. You see. And so then I'm going to take, just because I'm very familiar with doing this, because I want you to feel. So now I'm applying a little bit more pressure than I normally would at the bridge, just for you to feel the difference. But then we're going to simply softly come around under the eyebrows to the bottom of the earlobe. And we're just following that eyelid line right below where the bridge of that nose hits the top of your eyes. Nice and easy. 3. We're going to do it 6 times. 4. 5. And 6. And then we're going to start at the bridge, actual middle part of the nose. And we're going to come across the cheekbone to the ear. And we're going to do this because, again, this is where fluid gets trapped in your eyes, in the eye cavity here, and in the actual, and by the nose.
And I can feel that you're really following the curvature of my face itself is kind of guiding your fingers.
Yes, because God made our faces and made our bodies so that fluid would drain an appropriate way, or our creator, I should say, because depending on who you come from or where you are, it's our creator. Whoever made you made us in such a way that they already knew where the fluid is supposed to go. So we're following what was already existed in your body as the natural lines for fluid to flow. 4, 5, and 6. Now, before I go to lower, because I have reached the ear level in the areas of the face, right at the base of the ear here, underneath, like you can kind of feel a crux. This is your first lymph node, kind of behind the ear. And I almost like to start from, there's like such a crevice at the very bottom. You'll feel kind of the indentation. And it's like I'm just making small little tiny circles. And here, I'm going to take your hand so you understand. And it's literally tiny circles. just by the ears.
Am I on top of the jawbone or in the crevice?
So you're actually in the crevice, starting right at the ear level.
Right at the,
Right at the ear level. Because we are going to go behind the ear too, but this one's right at the ear level because we just brought the fluid here. And you have 3 bones on your inner ear, and it starts at that first crevice and ends at the third. That's where the 3 bones. First one's right at the first crevice, second one's at the base of the ear, the third one's at the hole. So as long as you do about 6 curls, 6 curves, you're fine. And then what I'm going to do is I'm going to start at the top of the ear, and I'm going to move down the rest of the ear. Because, you know, we brought all that around your head. We need to bring it down to the rest of the ear. So I'm moving down behind the ear.
It hurts a little bit. Yeah.
There we go. And see, that's to know your own pressure. You are not meant to hurt. It is simply meant to move fluid. There should be no pain.
And if I could add to that, to encourage anyone, if you're on the table with someone else working on you, they can't feel what you're feeling. Speak up. Let them know.
Communication is key.
Communication goes 2 ways. And the amazing bodywork people, you know, if you are not comfortable and they say you're supposed to be, tell them.
It doesn't matter. We don't know everything. We don't know everybody. It is your body. You know your body better than we do. So speak up. We are only professionals to what we know, what medical taught us and what a book taught us. Every person is different. We all practice medicine. It just depends on, you know, who's listening. So I'm listening to my patient as you should, as your own patient, speak. So after we went down the ear, now I'm going behind the ear where you actually feel the hole. And here you might feel popping. You might feel the popping, whether you're pushing it or whether you're receiving it. Because that fluid right there is where it traps. There's 3 bones in that inner ear. This, for most patients with hypermobility, with neurocardic, with disconnects between your connective tissue of the brain to the body, this is probably one of the most severe areas that are trapped with liquids, is right behind this ear, because this is where your brain, your ear, that whole sinus cavity connects to your mouth, to your nose, to your eyes, and to your ears.
You're doing something interesting with your gathering here. You're kind of gathering into the circles.
Yes, because it's trapped. So because I took all the fluid from down your body, I want to make sure that it is actually emptying, because here's a lymph node. There's a hole here that goes into your lymphatic system. So I'm being sure that any fluid that has gathered around the inner ear bones, around the cartilage here, is truly emptying. Because that's why the little small circles, just tiny little circles that are going on behind the ear, you want to be sure it breaks up. Now, I do a count here, probably about 15 to 20 seconds. You know, the 6 to 10 works for moving it. For actually draining it is usually about a 20-second to 30-second circle motion, to be sure. You don't have to do this many. It depends. If you feel the popping, there's still fluid. And you want to be sure that you're getting rid of that. So as long as you're feeling any popping.
Can you show that test you just did on the camera side?
Yes, they're seeing it actually.
Feeling it. Oh, yeah.
Yep, it's actually directly on it. And so hopefully you are seeing that. But it is, she has a lot of fluid because I've already been sitting here a while and I'm still feeling the popping. Come here, I want you to see your hands and go behind yours, because I want you to feel the circle. I want you to feel the popping that I'm talking about. And it's just tiny little circles. And they'd be like just a simple little pop inside your skin almost. That's fluid popping. You have more on the left side that I feel.
I'm not sure I can feel the popping, but I do feel like this side is a little bit more puffy to me, so I probably need more practice to and I can sometimes hear it. I can hear a little tiny
like this.
Crack. Oh, yeah.
Like boom. Every time. Well, now it's less. See, we're finally now.
It's
the amazing
moving.
thing is when you stop feeling the popping, it's actually moving. And so now we're going to bring it down. Anything that was residual, we're going to start from that ear, come down the neck, easy. Because anytime you touch on the neck, easy. So I usually take all four, my fingers, So as if you were kind of holding your hand, you don't need your thumbs. And we're just moving all 4 fingers from the ear down the neck. It's almost like just the fingertips are what's all that's needed, just the fingertips. But I'm bringing it down because, again, this is the major drainage is in your neck. And so I want to make sure you get that any fluid that trapped itself here behind under the ear that did not escape. We don't want it to leave any issues in the ear. So we're going to come down that neck, come down the carotid artery, come down the lymphatic from your medulla oblongata, your cerebellum, down into the appropriate drainage.
And this is very smooth. It is not irritating my vertebra. The neck isn't being pinched, pushed, or pulled. It's very smooth.
And it is literally all you're doing, again, is only your fingertips, so it doesn't take much pressure. So if it hurts, stop. Tell them no, it's too hard. Mm-hmm. It should not be, you shouldn't see red marks on the skin in any means doing this.
That's a good note about the red marks. What about other types of pain? If they feel pain, should they stop completely and try later, or just stop and rest for several days?
2 pains that would concern me. 1, especially under the ear. If you're under the ear and you literally, as soon as in ear you do your own circles, or anyone's doing circles, and you feel almost like the best way I can describe it is like electric, almost like a shocking or a pulse, stop. Because somewhere there is so much fluid and probably infection, because a sign of like almost like an electric feeling is known to me that there's infection in there somewhere. A lot of people's sinus infection. It doesn't mean you can't get past it, but we're not trying to cause pain. If you feel that, I always suggest to stop and hydrate first. This is going to sound crazy. What brings on electricity?
Mm-hmm.
Thunder, rain. What stops it? Water. Believe it or not, water. So putting water to it and drinking opens up so that it can release whatever electricity or electrons are trying to produce through your body. The only other pain that I can say that I have that I would say that you would want to stop for is a throbbing. So if you got a throbbing kind of pain as anybody touching you, then it's probably infection somewhere else in your body. And I'm not saying that you can continue, but we're not trying to cause pain. And maybe now is not the time, and later you can recontinue. So any throbbing or electric kind of feelings you want to stop.
Mm-hmm.
Okay. So we're going to move down the body.
Why don't we do a restart?